Here we will be demonstrating the waist and hip circumferences and how we measure those. Circumferences of specific anatomy may be used to represent body composition. They also provide an additional measure and tool for health categories and risk stratification. We will be demonstrating both the waist measurement and hip measurement. However, before we get into that demonstration, we need to go over how to use proper technique when taking these measures. To take these measures, we use what is called a Gulick tape. This is a spring-loaded tape that reads both metric and standard measurements. The measurements that we take will be done while slightly compressing the subcutaneous fat around the measurement site, but we will explain this a little bit more in depth once we actually demonstrate the measures. The sites that we measure at are taken twice in rotational fashion. So what that means is we will take a measurement at each site one time and then go back through for a second measurement at each site. A third or fourth measurement may be required, but the minimum is 2 measurements per site. We average these 2 measurements together, and we have to make sure that these 2 measurements are within 5 millimeters of difference at each site. So for example, if you were to take 2 measurements at the waist, they need to be within 5 millimeters of each other to make sure that the measurements are as accurate as possible. If they are outside this difference, it will be required to take additional measures. So to start, we are going to go with the waist measurement. This measurement is done with the subject standing, arms by their side, feet together, and their abdomen relaxed. The Gulick tape will basically be placed around the abdomen area of the individual between the bottom of the sternum and the umbilicus or the belly button. So to start, you have your subject slightly lift their shirt, exposing their abdomen. This improves the accuracy of the measurement as we don't want to measure over clothing. Have your subject hold the tape on their side, whichever side you decide to start on. You will then walk the tape slowly around the individual. What this does is it provides comfort for your subject. It also allows you to make sure that the tape is not twisted and make sure that it is level all the way around, which is going to improve your measurement. Again, going back to the procedural point, once you've come back to the start position, you need to apply some slight pressure with the Gulick tape. This is going to apply some compression against the skin of the subject. Again, this is proper procedure and will allow for accuracy of measurement. Once you've taken the measurement, you can release the tape and let it fall around the individual and wheel the tape back up. The one thing you want to avoid doing is what is called the lasso technique, where you actually reach around the subject to place the tape. From a professional standpoint, this can make the subject be a little uncomfortable, so you want to avoid this technique. Make sure the walk around technique is used for these measurements. Once again, you will take that waist measurement and then we will move on to the hip measurement. This is also done with the subject standing, legs slightly apart this time, however, and the tape is going to be placed at the widest part of the hips. So again, you start at the side of the individual, you place your tape, and you have them hold. Again, using the walk around technique, walk the tape around slowly, making sure that it is not twisted and making sure that it stays level all the way around. Once you reach the start point, apply some slight pressure with the tape to slightly compress the area to make sure that the measurement itself is accurate. Once you've gotten your measurement, you can release the tape. And again, you're going to repeat these measures once at the hip, or once at the waist and once at the hip. You would then have 2 measures at each site. Make sure that they are within their 5 millimeter difference. If they are, no more measurements need to be taken. If the 2 measurements at each site are greater than 5 millimeter difference, you may need to repeat one of the sites. Before the subject comes in to have this test performed on them, make sure that you as the technician communicate to them that clothing requirements are important. Subjects should come in wearing t-shirts and shorts, basically clothing that are fairly minimal in terms of size. You don't want to take these measurements with individuals wearing jeans and sweatshirts and things that are large in nature, as that can affect the measurements. So for our subject here, this is a perfect example of what an individual should be wearing. Just t-shirts, shorts, they're fairly thin. That's going to improve the accuracy of the measurements that you will be taking.